I was diagnosed 2 years ago with stage 4 high serous ovarian cancer. They did a 10-hour surgery followed by 5 months of IV/IP chemo. I was on a very strict keto diet, and my CA-125 numbers have remained very low, around 10, 11, 11, 12. And then gradually the last 6 months, I've gone a little bit more plant-based, introducing more beans and more grains. And listening to you today, obviously, I think you've answered my question. The GKI will indicate whether I'm in ketosis or not anymore. I think that was my question.
Yeah, well, just like when I showed with Pablo Kelly in his managing of his glioblastoma, there is some slippage a little bit, but he has come into a new diet and lifestyle that kind of maintains, and I think maintains the slow growth. Let's put it that way. Again, he's not cured, but he's, and like yourself, at some point, if you can get access to the other parts of the press pulse strategy, you can discuss this with your oncologist. If you now that you have this information, you can discuss this and discuss options that may help you maintain a quality of life and a management of the tumor. So I think you have the what I gave you, and now you can discuss this to see if you can continue to maintain very, very slow, if maybe resolution of your tumor. I don't know, but at least that's what you can do.
Thank you. Thank you very much.
All right, thanks, Anne, for that. And now next we have Tony. Tony, what is your question?
Yes, last July I was diagnosed with low-grade B-cell follicular, which progressed to moderate diffuse large B-cell non-Hodgkin's lymphoma. And I've been on CHOP-R for 4 cycles. I've got 2 more to go, obviously the prednisone. And curious if this metabolic theory also applies to lymphomas. I see most of the lectures about solid tumors.
Yeah, lymphomas are the same as the others. They're bathed in glutamine because they're in the blood. And when you look into the scientific literature, you'll see the mitochondria in lymphomas. All the different blood cancers have defective respiratory capacity. Therefore, they're based on fermentation, just like the solid tumors are. So, yeah, I mean, it's remarkable when I looked into the scientific literature and looked at the mitochondria and all these cancers, they're all defective. And what that means is they have to use glucose and glutamine. So lymphomas, non-Hodgkin's lymphoma, or even Hodgkin's lymphoma, they require glucose and glutamine. So again, that's the common problem. And if you look at your treatment, CHOP, I mean, CHOP is a cocktail of toxic drugs that will break DNA, stop replication. Yeah, you can get effective treatment for that, but also pulling the plug on the glucose and glutamine can do it without toxicity. I mean, you can manage cancer with toxic, really radical toxicity, of course, but at the same time, you put normal cells of your body at risk for damage from radiation and chemo, which is not healthy. On the other hand, you can manage the cancer by selectively targeting glucose and glutamine using press pulse metabolic therapy. But as the questions I've said, most oncology, bring it up to your oncologist and say, can I do press pulse metabolic therapy, and see what they say. And then you'll know the answer to your question.
Thank you.
All right, thanks, Tony. Next we have Cheryl. Cheryl, what is your question?
Hi, Dr. Seyfried. Well, Tony just asked my main question, and I have a second question, but first I just want to thank you so much for your work and your commitment to finding the real truth. So my question is, if someone has a watery cancer, like specifically double hit non-Hodgkin's lymphoma, and he's been doing conventional standard of care treatment for over a year, I think it's mainly experimental chemo, and he's survived so far. Can he benefit by switching to the metabolic therapy, or does it ever become too late?
Well, I don't think anything for the most part, becomes too late. If the patient is still cognitive and still functional, you can always integrate metabolic therapy. And I don't want to say that metabolic therapy alone it should be used. I mean, there are many people who do conventional standards of care and they combine it with metabolic therapy because in general, when you're into a state of water fasting or ketosis, the normal cells of your body get healthier. So you're always going to be helping the normal cells do this and can reduce some of the toxicities of these powerful toxic chemicals. The work of Longo has shown that people who are taking, who are on water-only fasting, do have much less toxic effects from the standards of care. So I always think that yeah, it can be used together with standards of care. Whether it's better that way or is it better by itself, we're still working out the details. But yeah, I think it could be done with standards of care, and you discuss this with your oncologist and see what they think.
Thank you so much.
Okay, thank you, Cheryl, for that. Next, we have Kaylee. Kaylee, what's your question?
Thank you. Please, have studies been done correlating the advent and increase of the use of cell phones along with the rise of the glioblastomas? And is there also a study being done or has been done of where the tumors in the brain occur and correlating that where the cell phones are held to the head?
Yeah, that's a good question. Well, I went to England a couple of years ago where they were looking at the kinds of magnetic pulses that come out of a cell phone. I think the risk is probably more for young people, young kids where their skull is less thick. And they really penetrate deep. The arguments were that cell phone electromagnetic waves don't cause mutations, and therefore they would say that the cell phones don't have any impact on brain cancer. But the whole thing, mutations are irrelevant anyway. So what's important is how would electromagnetic pulses potentially initiate a tumor, and what happens is heat. The heat from the cell phones can actually cause inflammation in the microenvironment. And it's inflammation in the microenvironment of the cells that ultimately leads to mitochondrial damage and the origin of cancer. The mutations are largely irrelevant. So the question then should become, is it possible that cell phones could create an abnormality in the microenvironment of the brain that could elicit a brain tumor? And the answer is probably more likely in young people than in older people. Only because of as I said, the skull thickness. So it's an important question, and considering how widely used the cell phones are, computers and a lot of different kinds of things, they probably do represent a risk factor. It's very hard to quantify that risk factor, but obviously knowing 5G networks and all these kinds of things, electromagnetic radiation, it's probably a risk factor. It's been very hard to specifically say that someone's tumor was caused by cell phone use. Usually it's a combination of a number of different things that would probably elicit something like that. But we certainly cannot rule out completely that cell phone use is innocuous and has no relationship to the origin of cancer. So I think there's a possibility there, but I don't do that kind of research, and I'll leave that to others.
Thank you.
Okay, next we have Gretchen. Gretchen, what is your question?
Thank you very much for your input. As you reject the standards of care for cancer, and it would appear that you respect and have done an extensive amount of research and publishing, have you respectfully researched the cancer work of Nishio Kushi in Macrobiotics, part of the collection of the Smithsonian's National Archives? Macrobiotics deals a lot with the acid-alkaline balance for one aspect, and as far back as the 60s had far-reaching success in dealing with cancer and other maladies. I've been involved with the macrobiotic community since 2003, and I have equated macrobiotics to plant-based eating for Mensa-level thinkers.
Yeah, well, I mean, certainly, well, we did some research on this, Actually, I'm writing. In fact, I'm working on a big paper right now for the alkalinization thing. The acidity is caused by the fermentation metabolism of the tumor cells. So that creates local inflammation and acidification of the microenvironment from the waste products of the tumor cells, which facilitates the spread. We try to stop metastatic cancer by using alkaline materials. What is it? Sodium hydroxide, one of these things. We couldn't get any therapeutic benefit from it at all. So the best way to stop acidification is pull the plug on the fermentation metabolism. If you do that, you're going to stop local acidification. As I said, you can do a lot of different kinds of things. If you know what's causing the cancer to grow, then just pull the plug on that and see what happens. If macrobiotics can do that, then do that. It's just sodium boro. What is it? What is that? Baking soda. We tried that to try to alkaline. It didn't work at all. So it didn't stop our metastatic cancer. Maybe it'll stop somebody's. I don't know. But we know what the problem is. We know how to go after the problem. People just have to know that they can do it or not do it. It's whatever they want to do.
Well, my real question was, and if you haven't researched the workings of Nishio-Kushi on cancer, I respectfully suggest that you might be fascinated by what you find.
Okay, I'll look into that. Thank you.
Thank you. Hi, I'm filling in for John. We had to step away to do some technical stuff. So my name is Nancy, and the next question is from Aaron. Aaron, I'm going to unmute you if you could ask your question.
Hi, so as a follow-up to the answer you gave Steve about what food should we eat or how they affect our sugar intake and ketosis, so you suggested to use a device and check. So my question would be, how much time after you eat a food you should test yourself and see how does the food affect you? And my second question is about what are your thoughts about immunotherapy? Do you think that this is also toxic treatment? Thank you.
Yeah, well, that's a good question. You can try it. We did these experiments on ourselves and students. We gave Coca-Cola, right? And we tested red wine as well. So the way we did this was we had the person or the student not eat anything for like 36 hours. So you kind of burn up your glycogen in the liver. You get kind of a nice baseline, and then drink a Coca-Cola, standard high carbohydrate Coke. So my associate did this, and the blood sugar, we measured the blood sugar just before they drink the Coca-Cola, and it was about 89 milligrams per deciliter. Okay, which is good. It's with a normal in the normal range. And then she drank the Coca-Cola, and we waited 15 minutes, and we measured the blood sugar again, and it was 165 milligrams per deciliter in 15 minutes. Now, of course, insulin surge will gradually reduce the sugar, but it takes in Coca-Cola. And then one of my other students went on a 3-day water-only fast, and then drank a glass of red wine, Cabernet, a thick red wine, I guess you could say. And the blood sugar didn't change at all. It was shown that the Cabernet did not raise the blood sugar, in striking comparison to Coca-Cola. So, these kinds of experiments, everyone should, people can do on their own. Like the answer to your question, you can get the answer to your question by measuring your GKI certain periods of time after you eat certain things. And that's what I said. So eat a banana and see how high it goes versus taking in grapefruit. All of these things can be done. You have to measure before, get the number, and then after a certain period of time after. You can do it at 15 minutes, an hour, and you can see your blood. You see gradually. If it gradually declines, that means your insulin is working. If the blood sugar stays up and it doesn't go down, you got an insulin problem. So insulin insensitivity, this is what underlies type 2 diabetes. And a lot of type 2 diabetics are at high risk for cancer because they can't clear the glucose out of their system after they eat this thing. So a lot of these things can be done by the individual themselves. What was the other part of your question?
About immunotherapy.
Oh, yeah.
This is something that, been offered lately. And what are your thoughts about this type of treatment?
Yeah, well, it's very expensive. It has the probability of giving you some therapeutic advantage, like that paper I just showed at the beginning of the lecture on the non-small cell cancer. But it also can accelerate how fast the tumor can grow. So it's a mixed bag. It's not really clear. Some people do really well in immunotherapy. And it's funny, an interesting paper came out not long ago, and they call lactic acid a checkpoint inhibitor block. Lactic acid blocks they think will block the effects of immunotherapy. Well, the lactic acid is coming from the tumor's use of glucose, dumping out the lactic acid. So again, immunotherapies will probably work a lot better if the patient is in nutritional ketosis. I mean, it becomes very, very clear. As a matter of fact, I think all of these cancer treatments will work much better if the patient is in nutritional ketosis before they take the therapy. So, and that's becoming more, there's a number of papers coming out saying that immunotherapies can work better if the patient is in nutritional ketosis. Then the question becomes, if you do nutritional ketosis with pressed pulse, why are you taking immunotherapy in the first place? It doesn't make any sense. So, and it's also immunotherapies are based on the somatic mutation theory of the disease. So if cancer is not a genetic disease, why are you using immunotherapies in the first place? But they'll do it because they don't understand the rest of the biology of the disease. So, but it's going to be a transition period before the field comes to realize how the best way to manage this disease is.
Thank you so much, Doctor.
Thank you very much, Aaron. Okay, so the next person up is Deborah. I'm going to unmute you. If you could ask your question, please.
Hi, thank you for taking me again. I have like two things to ask. One was, we've talked a lot about treating cancer and all these kind of programs and thoughts and ketosis and different treatments for cancer. Are there any things at this point that you recommend along these lines where you've studied that helps those of us without cancer to beat the odds of, our doctors who told us you're going to get it anyhow, just no matter which one, because it's genetic, just how to be more preventative. I know, ridiculous. And then the other thing I just want to ask quick, only because I was exposed to it in South Africa, was the use of ozone treatment. And what your thoughts were about ozone, if it's just hocus pocus or if it's actually something that's beneficial in it, because it was in a preventative nature, at a health spa thing. So those are my questions. Thank you.
Yeah. Well, the ozone part of this is we tried that, and there are some examples, I think, in the literature. It's not like many publications on that. It didn't work for us in the preclinical system. But so I mean, to focus, I was thinking more about the ozone, because we did try that. We didn't publish it because we had a couple of students that were doing it, how the ozone is nice, and we were looking at cancer and this kind of thing. I'm not going to say that ozone doesn't help. It's just that it's not as profound as what we see when we target the glucose and glutamine. And what was the first part of your question again?
As I said, I was doing ozone.
Oh yeah, prevention. Yes, prevention. Okay. Yeah, prevention. Okay, well that's a different. Okay, so if here's the situation. If the origin of cancer is the result of damage to the oxidative phosphorylation system in a cell in a particular organ, that's the origin of cancer. So it's hard to get cancer if your mitochondria remain healthy. Okay, so as long as you have a diet and lifestyle that reduce inflammation and maintain the health and vitality of your mitochondria, the probability of getting cancer is very rare. Primitive tribe, like the great humanitarian physician Albert Schweitzer, studied primitive peoples in different continents, and cancer was very, very rare in humans that were in a diet and lifestyle similar to that we evolved in. Eskimos, Inuits of the cold climates, had no term for cancer. And they're eating, blubber and fat in their environment. As long as you have a diet and lifestyle that does not cause systemic inflammation, the probability of getting cancer is very rare. So why is our societies throughout the world, where cancer now is overtaking heart disease, why do we have this problem? It's 99% of it is diet and lifestyle. We did not evolve to eat jelly-filled donuts, pizza, Coke. This was not part of our existence. This all started with the Neolithic period. Once we started using grains that have a lot of energy, yes, that help. We got bigger as a people. But it also highly processed carbohydrate foods over the last 35 or 40 years are putting us at enormous risk for cancer. Until people come to understand this, we're not going to be able to prevent the disease. So, most people don't care. They don't care about prevention. I mean, I can tell you right now, you just go down to any, food shop, you see people, they're eating things. You say, are you worried about cancer? I don't care about cancer. Then when you get cancer, then they're at, oh, now what are you going to do? I got cancer now. Now what are you going to do? So, but yeah, prevention is if people want to, avoid toxic foods and high carbohydrate, things that are going to cause systemic inflammation, then you put yourself at risk for cancer. Okay, smoking puts you at risk for cancer. Obesity puts you at risk for cancer. And where does obesity come from? Lack of exercise and eating high carbohydrate foods puts you at risk for obesity. Systemic inflammation, cardiovascular disease, cancer, dementia, they're all related to the diet and lifestyle. Very little on the genetic spot. It's mostly that. So that you can, do things to prevent.